This is Dr. James, and if you like the way I teach, please check out helpmommy.com. It's a completely free resource for parents. Or if you want to see me personally, I'm in Oak Ridge, Tennessee at Kids Central Pediatrics. And if you'd like to just have some of the way that I teach and the way that I treat my patients, you can check out my book. It's called The Big Book of Why for Parents. It's on Amazon and Barnes and Nobles. But today, I want to try and save you some money. Because at some point, almost every parent is going to take their kid to the doctor because they're worried because they have an ear infection, because they're pulling on their ear. And I want to teach you how to tell the difference between pulling on the ear that's not an ear infection versus one that you legitimately have a concern. The first thing you need to know is almost every ear infection. Now, this isn't talking about swimmer's ear, but like the ear infections that people are thinking about that they need oral antibiotics for, they are almost always going to happen in the middle to the end of a cold or because you've had lots of allergies with runny nose or cough. If you don't have runny nose and congestion, you really don't have much of the setup you need to develop an ear infection. What needs to happen with an ear infection is you have this tube, it's called the eustachian tube, and it goes from the middle ear down to the throat. The lining of that is respiratory epithelium, the same that lines the inside of your nose and throat. So something needs to happen that causes that to swell so that it swells shut. When it swells shut, it creates a vacuum in the middle of the ear. Our body doesn't like a vacuum, so it fills full of fluid. That fluid is great food for bacteria. The bacteria from the nose and throat ends up getting sucked up that tube when the ear pops or something. Then that bacteria starts to live in it, creates pus, swells, causes pain and fever. That's an ear infection. So if you have not had a cough and have not had a runny nose and don't have any fever and your baby is pulling on their ear, they probably don't have an ear infection. You are going to waste your time and your money going to the doctor's office and probably risk exposing your child to other illnesses because this isn't an ear infection. You need that setup to have it. So if they don't have an ear infection, why are they pulling on their ear? When I was in medical school and residency, they taught me the rule of T. See, everything in this area that starts with the letter T can refer pain to your ear. So you could have ear pain because you're teething. You could have ear pain because there was something wrong with your tongue. You could have ear pain because there was something wrong with your tonsil, your throat, your TMJ, and of course the tympanic membrane or the tube of your ear. Those were the things that were going to cause you to have ear pain. So if you haven't had a cold, runny nose, snot, things like that, and you're pulling on the ear, chances are it's one of the other T's, not the tube or the tympanic membrane. So then think, could my child be teething? The other things they can do it is sometimes they just do it because they're tired. That was the way my oldest was. He would just have this thing that when he was tired at night, he would pull and he'd scratch at his ear. He had so many little scratch marks in his ear. I probably looked at his ears 100 times throughout his childhood. Never once did he have an ear infection. Other things is that they just have a hair that's tickling it or bothering it, or they found it. So a good rule of thumb, if your kid has had a cold, runny nose or cough, and they have a fever, or they're screaming, and they're pulling at the ear, think ear infection. If they've not had runny nose, congestion, or cough, and they're pulling on the ear, and you're not seeing a fever, wouldn't waste my time going to the doctor.